Hey fam, happy Monday. This is Nurse Eunice with Florida Training Academy, and tonight we're going to be reviewing 55 multiple choice CNA questions. It's also a little bit more challenging to help those PCTs with their exams too. So as we do in each of our videos, we're going to give you about 10 seconds to receive your notifications. And I know it's a little bit early if you're on the East Coast, but we have viewers from all around the world who listen in, who study with us. So wherever you are, it is time for Monday Night Trivia. Let's get started. All right, so welcome to our PCT and our CNA Trivia Night. Getting ready to test your skills, challenge your knowledge, and have some fun. Whether you're a student, a new grad, or a healthcare pro, this is for you. Hey, Jonah. All right, and so of course this is brought to you by Nurse Eunice and Florida Training Academy, where we empower caregivers and we change lives. And if I haven't told you this week, I know I said it last week, happy CNA week, everybody. Mwah. You all are the backbone of the healthcare system. You take care of the patients, you take care of the nurses, the doctors, the family members. So without you, there would be no nurses. So I do appreciate you all. All right, so let's see. Jonah, congratulations on passing your CNA exam. I am so proud of you. All right, so question number 1, team. While assisting a resident during lunch, you notice them frequently clearing their throat and coughing after swallowing. What's your next best action? Would it be to notify the nurse immediately, to encourage them to eat slowly, to offer a drink of water, or to perform abdominal thrust? What do you want to do, team? Remember, this is rapid fire, so reveal the answer in 5, 4, 3, 2, and if you chose A, that is it. They're coughing while they're eating. That's a sign of aspiration. So repeated coughing after swallowing may indicate aspiration risk. The nurse should come in and assess that patient before you continue feeding them. And you would not have to perform the abdominal thrust because this patient's able to cough and clear their own airway. You'd only perform abdominal thrust at the point when the patient stops coughing. Question 2, a patient suddenly becomes confused and agitated during a routine bed bath. What is your first response? A, restrain the patient to keep them safe. B, pause the bath and speak calmly to the patient. C, quickly complete the bath to avoid distress. Or D, call for another CNA to assist. All right, I see some of my frequent viewers. Hi, family. Hi, friends. All right, let's see what answers we have in 5, 4, 3, 2, and the answer to question number 2 is going to be B. That is right. So if they're agitated, pause it. That's the safest thing to do. And you're going to speak calmly to them because sudden confusion could be a sign of delirium or discomfort. Calming the patient helps assess and de-escalate the situation. So let's try to use those de-escalation tactics. All right, question 3. Oh, this is a long one. So, which of the following statements best reflects the CNA's role when sterile technique is required during the procedure? Is it A, the CNA may assist by applying sterile gloves and prepping or preparing the sterile fill? Remember, this is a CNA, not a PCT. Or B, the CNA is responsible for maintaining the sterility of instruments during the procedure. C, the CNA observes the sterile procedure and reports any breaks in the technique to the nurse. Or D, the CNA performs the sterile procedure as directed by the nurse. Oh, that was a lot. So this one requires you to know your role as a CNA. What is your scope of practice when it involves procedures that require sterile gloves? And that's right. I think it's Erinone. I'm just going to call you Cynthia. Hi, Sierra. You are correct. It is C. So a CNA cannot perform sterile technique. You cannot. Once you are in a hospital, they'll change your name, change your title. So if you have a CNA license and you're hired to work in a hospital, they'll call you a patient care tech. At that point, they may train you to apply sterile gloves and perform sterile techniques such as catheter insertion. But when you're taking your basic CNA examination, the answer is always absolutely no. A CNA cannot perform sterile technique, but you could tell me if I broke sterility. So CNAs do not perform sterile procedures, but can assist by observing and reporting any concerns. Maintain sterility is the responsible of a licensed personnel, such as an LPN or RN. All right, question 4. A patient on fall precautions is trying to get out of the bed unassisted. What should you do first? A, stay with the patient and assist them safely. B, activate the bed alarm. C, tell the patient they must wait for help. Or D, go get the nurse immediately. And watchful eyes, Dee Dee, Hannah, Marie. Let's see who else is joining us. Sierra, Cynthia, Besterly, Miss K. If I missed anybody, I'll make sure I go back later and call them out. D. Jean. All right, so revealing the answer in 3, 2, and yes, it is A. Stay with the patient and assist them safely. The patient safety comes first. You never want to leave an at-risk or a fall risk patient alone to go call the nurse because they could fall. So you want to help them safely. And then once you can get them back into bed or get them, comfortable in a chair, that's when you can notify the nurse. Oh, thank you so much, Marie. I appreciate that comment. So everybody, Marie said, hello from Long Island. Hi. I enjoy watching your videos. Very informative. Well, I enjoy making videos for you to watch. All right. Question 5, team. A PCT is checking a telemetry monitor and notices an irregular heart rhythm. What is the most appropriate next step? A, silence the alarm and continue rounds. B, note the time and monitor for trends. C, report it to the nurse without delay. Or D, print out the rhythm strip and file it. So what do you do when you notice something abnormal on the monitor? What is the safest answer? And this one's so easy because, yes, it is going to be C. You need to report that. Report it to the nurse without delay. And so yes, we offer online PCT classes. You have to be in the country of the United States. I do apologize because it does require you to learn EKGs, phlebotomy. And so you would have to be able to go to a site in your area. Yes, we even help you get your externship hours, but you do that by going to floridacareeracademy.com. Just scroll down to the bottom of the page and you will see the option for our PCT courses. Again, that is floridacareeracademy.com. All right, question 6. A CNA notices that a patient's urinary catheter bag is positioned above the level of the bladder. What is the best action to take? A, clamp the tubing to prevent backflow. B, disconnect the bag from the catheter. C, disconnect and reposition the tubing. Or D, lower the bag below the bladder level. That's right, Hannah and Hawa. Let's see who else we have. All right, revealing the answer in 3, 2, and I see you, Lawrence. Yes, it is D. That bag should never be above the level of the bladder. If you raise the bag up, the old urine can go back into the urinary tract. So anytime someone has a urinary drainage bag, keep it low, okay? And as the rationale states, the drainage bag must always be kept low, below the bladder level to prevent backflow, which could lead to infections. And I'm trying to stay off camera because my streaming system has not been the best lately. And I do apologize for you all who've, you're faithful, you watch. I will be trying to find a new streaming service next month. But in the meanwhile, I may have to keep my camera off so that we don't have so many technical difficulties. Question 7. When providing oral care to an unconscious patient, what is the safest position to place them in? Remember, if they're unconscious, they don't have a gag reflex. So are you going to have them prone, supine, in high Fowlers, or side lying? Ooh, this one's tricky. It is tricky, tricky, tricky. We have answers all over the board. And so prone is face down. Supine is laying flat on their back, which of course puts them at risk of aspiration. High Fowlers, look you all with the high Fowlers position. I know that sounds like that would be logical, but this patient doesn't have a gag reflex. So if you sit them upright in a high Fowlers position, and even the smallest amount of moisture from the oral care procedure gets into their throat, they can't cough it up. So the answer is not C. The answer is going to be D as in dog. So great job. You turn them to the side. The reason being is because when they're positioned on the side, any oral fluids would, of course, accumulate in the cheek area. If you have your suction wand, you can remove the secretions that way. If you don't have a suction wand, you can take a tongue depressor and a washcloth and just gently remove the excess secretions. All right, question number 8. Mrs. Love, child of God, you have to send me your results. So I'm not going to post that one online. 76 out of 72. You were 72 out of 76. You were so close. You have to send us your results because I don't know how you're studying. I don't know who's helping you. So just telling me what your score is without telling me what books you utilize, what your instructor that you work with in your home state has done, it really doesn't give me enough information, but you're very close and looks like if you just keep practicing, you should pass that exam. All right, so question 8. A PCT is asked to obtain a blood glucose level before lunch. Which of the following is the most important to do first? So these are your prioritization questions. Is it A, wipe off the first drop of blood? B, use the same lancet for multiple patients? C, shake the glucometer strip? Or D, skip hand hygiene if gloves are worn? And Ms. Love, child of God, I'm putting our email address in here. You have to send me your test results and also what you use to study and your study materials. All right, revealing the answer in 5, 4, 3, 2, and it is A. I know no one does it in the real world, but you know better, so you will do better. You're supposed to wipe off the first drop of blood because it may contain tissue fluid, not the blood itself. It could be, it could just be a little bit watery. So wiping it off ensures a more accurate glucose reading. And I do want to restart my camera. I just want to come on and say something to you all quickly. And so if you are not passing your written examination, don't forget that when you take your CNA exam, you can ask for a oral examination or an audio examination in which they will give you an audio headpiece that actually reads the questions to you and the answers, and you can repeat that as many times as needed. You all, that's a game changer. So if you're maybe a foreign-born CNA, if you're from another country, or if you don't understand some of the terminology, if you don't understand the terminology and you misread it, of course, you're going to choose the wrong answer. So always as a safeguard, whenever you're taking your CNA test, if you are so close to maybe if you cannot consistently make an 80% or higher whenever you're doing your practice test, I need for you to request an audio examination. Usually it does not cost any more money. All right, so that's my little pointer because I need you to pass your test. All right. So the answer to question 8 was A, as indicated there. Question 9. All right, thank you for sending that to me. All right, question 9. You enter a room and notice that a tracheostomy patient is having difficulty breathing and their oxygen saturation is dropping. Uh-oh. What is your first action? Is it suction the trach? Is it remove the trach tube? Is it to call for help and stay with the resident? Or is it to increase their oxygen? What is your role as a CNA? All right, Eltina, Hawa, Nadine. Let's see if we get 3 more. That's right. Did Jean, Cynthia? Yes, it is C. You never leave a person who's in distress. You're going to call for help while you are with them. Stay with them. So CNAs and PCTs, you don't perform suctioning. You don't adjust oxygen. What you do, what you do perform is that you would notify the nurse if there was a concern. And so the nurse will then come in and suction the patient and or adjust the oxygen if they deem it necessary. Question 10, and we're going all the way to 55. So question 10, a CNA is reviewing the stages of pressure sores during in-service training. Which of the following correctly describes a stage 3 pressure ulcer? Ooh, so we got stage 1, stage 2, stage 3, stage 4, and then unstageable. So stage 3, would it be A reddened area that does not blanch when pressed and with no skin break? Would it be B, a shallow open sore with a pink wound bed and partial thickness skin loss? Would it be C, a deep wound with full thickness skin loss and visible fat tissue? Or would it be D, a dark necrotic area with full thickness tissue loss and visible bone? Ooh, D sounds really, really, really bad. So remember, this is a stage 3, not a stage 4. So stage 4 would be the worst. So that's your hint. It's not D. And everybody got it. It was C. So a deep wound with full thickness, skin loss, and visible fat. So a stage 3 pressure ulcer involves what we just mentioned, but muscle, bone, and tendon are not exposed. And there's our reminder, stage 1 is redness without a skin break. As an African American, I disliked that in all the books they put redness because I am not going to turn red if I sit in one position for too long. I prefer the term discoloration, okay? Stage 2 allows or shows partial thickness loss with exposed dermis like a blister or a shallow open sore. And then we just discussed stage 3. And then stage 4 involves full thickness tissue loss with exposed bone, tendon, or muscle. And then the ones that are unstageable are the ones with the black S scar. So if you see a whole bunch of blackness where it's like, I don't know what's beneath that, we label that as unstageable. And that's when the physician will usually come in and debride. And when they remove that necrotic tissue, that's when we can stage it. But if it has the black scab on top, that is listed as unstageable until the physician does their intervention. All right, question 11. A patient tells a CNA, I don't want to take a bath today. I'm too tired. What is the most appropriate response? A, let's get it over with quickly. B, you must bathe now to prevent infections. C, if you refuse, I'll have to document non-compliance. Or D, okay, I'll come back later when you feel more rested. Vivian! Woo! You're so welcome. Congratulations. All right, everybody, revealing the answer in 3, 2, and Vivian, give us a 5-star review, baby, on Google. I'm so proud of you. It is D. So I'll come back later when you feel more rested because that allows you to respect the patient's right to refuse care and offer them a later time to return. It's supportive and it promotes autonomy. Don't forget to document the patient's refusal, okay? Because they may have sundowners, and when the family member comes, they may forget that they told you that they did not want a bath. If they refuse it twice, make sure you let your nurse be made aware. Question 12. A PCT is when a patient who is scheduled for dialysis at noon. When should the weight be taken? Is it after lunch, at bedtime, before breakfast, or before dialysis? And rightfully so, to be happy to pass your exam on the first try. Do you have any tips or any pointers that you want to share with the other viewers? All right, question 12, everybody. The answer is Yep, we need that empty weight. So you all have it. You're so smart. Dialysis patients are weighed before and after treatment to monitor fluid removal and assess fluid retention. The pre-dialysis weight, also called the present weight, helps to determine how much fluid needs to be removed during dialysis. Waiting until after meals or at bedtime would not give an accurate baseline. Question 13. Which of the following best protects a CNA from injury when transferring a heavy patient? Is it lifting with your back, twisting your waist during the transfer, using a gait belt and proper body mechanics, or keeping your feet close together? And thank you all for attending our Monday early evening night trivia. All right, everybody. The answer is C. You knew that. Super easy. I'm so proud of you all. A lot of you all have gotten 100% of the questions correct so far. So, question 14. A CNA is caring for a confused patient who keeps trying to pull out their IV. Oh, Lord, don't let that patient pull out the IV. The nurse will not be happy. What is the best response? A, apply wrist restraints immediately. B, reorient the patient and notify the nurse. C, remove the IV. Or D, ignore the behavior unless they succeed. It's only so many times you can tell Mr. Jenkins to stop touching that IV. Stop touching the IV. Stop touching the IV. He's not listening. So that's right, you all. You are going to do B because some things are above your pay grade. So you keep telling this patient not to touch it, yet they keep touching it. You're going to notify the nurse. And so we have little netting that we can put on top of IVs. Maybe your nurse will need to put a bandage on top of it. Or maybe this patient needs a sitter. You cannot sit in one room all day. You don't have enough. You have too many patients. You don't have enough time to do one-on-one. However, there are sitters and companions who are usually associated with the hospital who can. So reorientation and communication with the nurse are essential, as CNAs cannot remove IVs or apply restraints without orders. Question 15. During hourly rounding, a CNA observes a patient's Foley catheter tubing is looped and has no output for several hours. What should you do? A, straighten the tubing. B, irrigate the catheter with saline. C, remove the catheter and call the nurse. D, increase the patient's fluid intake. Revealing the answer in 7, 6, 5, 4, 3, 2, and this one was tricky. No one gave me an answer yet. And so there's been no output for several hours, but you see that the tubing is looped. So if the tubing is looped, that means that you need to go straighten it out. That is right, Eltina. It is A. So the loops can obstruct flow. Straighten it and reporting changes is appropriate and within the CNA's role. Once you straighten it out, if the urine flows, no nurse expects for you to come and tell us, hey, the tubing was looped and the urine was blocked. But if you straighten it and you still don't see any urine flowing, that is when you need to go ahead and notify your nurse, and don't forget to document. Question 16. Ooh. 1 ounce is equivalent to what? Yes, as a CNA, as a nursing student, you have to know conversions. So is 1 ounce equivalent to 10 mLs, 15 mLs, 30 mLs, or 45 mLs? All right, revealing the answer in 5, 4, 3, 2, and so many of you all answered it correctly. I am so proud of you. Like, everybody got it right. So 1 ounce is equivalent to 30 mLs or 30 milliliters. Some of your facilities will allow you to use cc's or cubic centimeters, but those terms are interchangeable in a lot of your facilities. So whether you say mLs or cc's, it's the same exact amount of fluid. Just go by what your facility prefers. Question 17. A patient tells you they are feeling lightheaded after standing up. What's the best response? A, encourage them to keep walking. B, sit them down and lower their head. C, call the lab for a stat blood draw. Or D, offer them a cup of coffee. All right, 5, 4, 3, 2, and Misha, you were the first one who got it. Misha Love, it is B. Baby, sit them down and lower their head. So some facilities may not allow you all to put a patient in Trendelenburg, others will, but this is when you would raise the feet higher than the level of the heart. But you cannot put a patient in Trendelenburg position without the nurse telling you to do so. But what you would do is get them back into bed and maybe elevate their legs on pillows. So this helps to prevent a fall and promotes blood flow to the brain. Always ensure safety first. So if someone's dizzy, get them down as fast as possible. Question 18. A CNA is assisting a patient with a bedpan when the fire alarm sounds. What is the most appropriate action? Is it A, leave the patient and immediately evacuate the area? B, remove the bedpan quickly and leave the patient alone? C, stay calm, ensure the patient is safe, and then check the location of other patients? D, yell for someone else to evacuate the patient. All right. Yep, super easy. I expect for you to race, and you all did it. Yes, it was C. You made sure the patient you were with was safe, and that is the first part of the acronym that you would think about whenever there's a fire emergency. Remember, RACE stands for rescue, alarm, or alert. So some places you'll pull the alarm, other places you'll have to call 911, just depends on where you're working. C, close those fire doors to confine the fire. And E, try to extinguish the fire. And if you can't extinguish it, that is when you would evacuate the building. So that is your priority. You always want to take care of the patient first. Question 19. Which of the following is a sign that a patient with a urinary catheter may have a UTI? Is it A, complaints of burning and foul-smelling urine? B, no urine in the bag after an hour? C, yellow, clear urine? Or D, increased appetite? All right, you all do understand the signs of a UTI. And so these will be the same signs, whether they had a catheter or not. It would be burning, and we call that dysuria. So that would be DYS, that stands for pain or difficulty, followed by URIA. So that's how you see it in the chart. But yeah, so painful urination and also foul smelling urine are signs of a UTI. Question 20. When transferring a patient from the bed to the wheelchair, which action ensures safety? Is it A, unlocking the brake for easy movement? B, making sure the wheelchair brakes are locked? C, placing the wheelchair behind the patient? Or D, lifting the patient under their arms? Which action ensures safety? Think about that CNA test you're going to take. What must you do before you transfer a patient? And that is right, Cynthia and Sierra and Cosmic and Tanisha and Alana and Vivian, you got it. Make sure those brakes are locked. And in our state, in Florida, for your CNA examination, whenever you're transferring a patient from the bed to the wheelchair, you must also use a gait belt. And if you need help passing your clinical skills, we have a playlist on YouTube. It shows every skill, you all. There's no reason for you to fail this test. I need you all to be CNAs, and I need you to go further in nursing. So I try to lower that barrier to entry and be your online tutor, because I know life is hard. I just want to make your day a little bit easier and help you pass this test. All right, question 21. A PCT working in a hospital is assigned to collect a 24-hour urine specimen. What instruction should be given to the patient? A, you can stop once the container is half full. B, you don't need to refrigerate the sample. C, save your first urine in the container. D, discard your first void and collect all others. And usually the patient just leaves the urine and you need to know what to do from there. So they went to the bathroom, you had the urine collection device in the toilet, they went, what do you do? All right, and if you chose D as Cynthia did, you got it right. So when you're doing a 24-hour urine, it must be kept on ice and you note the time that they first voided, but that one gets emptied. So in a 24-hour urine collection, the first void of the day is discarded because it represents urine that was produced before the 24-hour period officially begins. This void sets the start time for the collection. From that point on, every drop of urine must be collected for the next 24 hours. So that means sometimes you may need 2 or 3 containers, including the final void at the same time the next day. The collected urine is typically stored in a designated container and kept on ice or refrigerated to preserve its contents for accurate lab analysis. Question 22. A CNA walks into a patient's room and finds the patient is unresponsive and not breathing. What is the CNA's immediate action? A, perform a sternal rub. B, begin chest compressions. C, call for help and initiate CPR if allowed per policy. D, shake the patient harder. All right, Talia. All right, Talia says C. Let's see if she's right. In 5, 4, 3, 2, and that is right. So many of you all answered it correctly. It is C. So if you find a patient unresponsive, you're going to be calling for help. That's you pressing that panic button. You're going to be calling the rapid response team. And then if they're unresponsive and they do not have a pulse, you're beginning chest compressions if the patient does not have a DNR order. So remember, some patients have decided that they don't want to be resuscitated. So when you get your shift report, when you look at those patients' charts, you are looking at the patient's allergies, you're looking at their diagnoses, whatever, activities they may have, their diet order, but you are especially looking at their code status. All right, so CNAs who are certified in CPR and whose scope of practice permits may initiate chest compressions while awaiting the emergency team. However, if the patient has a valid DNR or do not resuscitate order, CNA should not be started, and the situation must be reported to the nurse or supervisor immediately. Question 23. A CNA is documenting the output from a patient's JP drain. Which unit of measurement should be used? Would it be milliliters, ounces, pounds, or grams? So that is their surgical drain. It's draining that serosanguinous or that bloody fluid that has accumulated around the surgical site. How do you document it? Is it A, B, C, or D? Oh, we're torn between A's and B's, but the A's have it. Yeah, so you all, smallest increments is going to be the milliliter. So liquid output, it says always, but remember some of your facilities allow you to use cc's. So liquid output is measured or recorded in mLs, milliliters, to ensure accurate tracking. Remember, if someone doesn't have a full ounce, let's say they only have 5 mLs, you have to use a smaller denomination or a smaller quantity, and mLs or cc's will allow you to do that. Question 24. A PCT is instructed to take orthostatic vital signs. What is the correct sequence? A, lying, sitting, and standing. B, standing, walking, and running. C, sitting, lying, and standing. Or D, lying, walking, and standing. Oh, that was a lot. Orthostatics. What's the purpose of you performing an orthostatic vital sign? And what order do you perform the vital signs in? That's right, safety first. The first one we're going to be doing is when the patient is lying, you all. So let me see what the answer is. In 5, 4, 3, 2, and it is A. So what if their blood pressure was low while they were lying down? Are you going to sit them up and then stand them up? Absolutely not. So when you think about orthostatic blood pressures, think about safety. We're doing this for a reason, because this person's blood pressure drops when they stand, or we're trying to make sure that their dizziness is improving. So you take the first one lying down, and then you sit them up on the side of the bed. Ask if they're dizzy. Take the second one. And if the blood pressure is okay and they're not dizzy, then you take the third one when they're standing, and then you put them back in the bed. All right. And so that is the order of your orthostatic blood pressures. Question 25. During AM care, a resident becomes tearful and says, "No one cares about me anymore." What is the best response by the CNA? A, "That's not true. Cheer up." B, "You should talk to your doctor about this." C, "Tell me more about how you're feeling." Or D, "I'll let your roommate know you're upset." All right, revealing the answer in 5, 4, 3, 2, and you are right. It is C. Remember, when you are communicating, it's more of you listening than you talking. So try to get that patient to open up, build that rapport so they can tell you about their feelings. So this response shows empathy and opens communication, allowing the resident to express their feelings. 26. A CNA is measuring a patient's fluid intake. The patient drank an 8-ounce cup of juice and a 4-ounce carton of milk. What is the total intake in mLs? You got to do conversions. So 8 plus 4 equals 12. We have a total of 12 ounces. And previously you told me that 1 ounce was the equivalent of 30 mLs. So if 1 ounce is 30 mLs, how many mLs are in 12 ounces? Ooh, 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 ooh. Revealing the answer in 5, 4, 3, 2, and it would be 12 by 30. So it would be B, 360 mLs. Boom. And so if you all need to come back and see that math, just come back and watch the video later, and you can always record that slide, but there's your rationale. Remember, 1 ounce is 30 mLs. So in 8 ounces plus your 4 ounces would be 12 ounces total, and you will multiply 12 by 30, and that's how we came up with 360. All right, so next question, please. Question 27. You are instructed to assist a patient with limited mobility to reposition every 2 hours. What is the primary purpose of this task? Is it A, to prevent constipation, B, to reduce snoring, C, to prevent pressure injuries, or D, to help the patient fall asleep? Why are we turning our patients every 2 hours? 5, 4, 3, 2, and Micheline, you got it. Yes, it is C. We're trying to prevent those pressure injuries. So regular repositioning prevents skin breakdown by relieving pressure on the bony areas. Question 28. A CNA is giving perineal care to an uncircumcised male patient. What is the correct method for cleaning the penis? All right, so when you take your CNA examinations, they usually don't have you cleaning male patients. But when you get out in the real world, you can't be like, "Oh, I don't want to touch him. He's a male." So you have to learn how to clean a male and how to do so professionally. Believe me, it's not comfortable for you or for him. This particular patient is uncircumcised, so they have the excess skin. Do you want to do A, retract the foreskin, clean the area, and then return the foreskin to its normal position, gently clean the penis without pulling back the foreskin? Do you want to do B, retract the foreskin, clean the head of the penis, and then leave the foreskin retracted? Or C, gently clean the penis without pulling back the foreskin? And then lastly, D, avoid cleaning under the foreskin unless the patient requests it. Well, D is just nasty. And so we're not going to leave the pee and the lint on his penis or the yeast. So it will not be D. You will pull back that skin, you will retract it, you will clean the penis, but then at the end, you have to bring the foreskin back up. So it is going to be B. For uncircumcised males, the foreskin must be gently retracted, and then you clean the area. After cleaning, it is critical to return the foreskin to its natural position to prevent circulatory issues or swelling. Question 29. You all are doing amazing. A CNA enters the room and sees a family member adjusting a patient's oxygen setting. Yeah, that's something my family would do. Girl, you don't like you get enough oxygen. Let me turn it up. What do you do? Do you thank them for helping? B, adjust it again to the original setting? C, ignore it if the patient looks okay? Or do you notify the nurse immediately? You as a CNA cannot adjust the oxygen. Oxygen's a drug, and for your test, CNAs do not give drugs. So since you do not adjust the oxygen flow, you got to get the big boss in there. You got to tell the nurse. So, and then the nurse is going to talk to that family member so they can stop doing things that are outside of their scope of practice. So adjusting oxygen must be performed by licensed personnel, your LPNs, your RNs, your respiratory therapists. So therefore, you must notify the nurse of any unauthorized changes. Question 30. A resident begins yelling at staff and banging on the tray table. I want my food and I want it now. What is your best response? Call security, yell back to establish control, remain calm and ask what's wrong. D, leave the room and return later. All right, so I have a funny story to share from when I worked psych, and we had half doors. And this was a really young patient. He could have literally just jumped over the door if he wanted to hurt me, but he just kept kicking the door because he wanted his pain medication right now. And I must have been moving too slow to his liking. And so I looked at him and I said, you kicked that door 10 times. Does your leg hurt? Yeah. You want pain medicine? Yeah. And then he stopped kicking the door. So try to de-escalate. Everything does not require you going hands-on with these patients and calling security. I knew that if he wanted to hurt me, he would not have been kicking the door. He would have been kicking the door in or jumping over to get to me. So I know situational awareness, it may take you a while to get there, but again, you can de-escalate, you can remain calm, and your patients will remain calm also. So the correct answer to 30 would be C. Remain calm and ask what's wrong. Use those de-escalation techniques. All right. And so you all, if you did not know, we have online PCT classes, which we discussed earlier. You can find out more information at floridacareeracademy.com. Just scroll down towards the bottom and find out information. So if you want to go beyond CNA, PCT, or a hospital level would be the next route. And so as a PCT, you're learning about EKGs, phlebotomy, and so much more. All right, question 31. Which of the following situations should a CNA not use a rectal thermometer? I haven't used a rectal thermometer in so long. So when would you not use one? A, the patient is unconscious. B, the patient has diarrhea. C, the patient is hypothermic. Or D, the patient is middle-aged. When would you not want to put the probe in the patient's rectal area to obtain their temperature? No brainer. If the patient has diarrhea, we're not sticking anything in. So rectal temperatures are not taken in patients with diarrhea due to the increased risk of mucosal irritation and or injury. Question 32. A PCT is helping a patient with a fractured hip move up in the bed. What is the best tool to use? Is it A, a slide sheet, B, stretcher, C, pillow, or D, wheelchair? You have to move them up in bed and they have a fractured hip. Revealing the answer in 5, 4, 3, 2, and that is right. You call it a slide sheet or draw sheet, but you're going to have a sheet beneath the patient and you're going to need help. One CNA on one side of the bed, you a nurse, someone else on the opposite side. You lift as a team and you get the patient up higher in the bed. That helps prevent further injuries, and it also stops their skin from dragging on the bed. If they had a hip injury, the last thing they need is you dragging a broken extremity. Question 33. Which of the following should the CNA report to the nurse? Let's see if you know your vital signs. Would it be a blood pressure of 118/76, a respiratory rate of 21, a pulse of 56, or a temperature of 98.6? Which is the most critical? I'm only giving you 5 seconds. 5, 4, 3, 2, and drum roll, please. 3 of you all came up at one time. It was Talia, it was Tanisha, and it was, I missed one. Talia, Cynthia, Lauren, you all had C, and that is the correct answer. So let me try to hide that. So you all, a pulse, a heart rate of 56 is lower than normal. So the correct response is going to be C. Everything else was within normal ranges. So a normal adult pulse ranges from 60 to 100 beats per minute. Therefore, a pulse of 56 beats per minute is considered bradycardia, which is a slow heart rate, which may be normal for athletes, but should still be reported to the nurse for evaluation. The other vital signs listed are within normal limits. And so, if you've been enjoying this video, give me a 1 or a thumbs up in the chat, because we have 22 more questions to go. All right, so question 34. A CNA is providing catheter care to a male patient with an indwelling catheter. Which action is correct? A, hold the catheter near the tip and clean toward the meatus. B, clean from the urinary opening down the catheter tubing. C, avoid touching the catheter while cleaning the penis. Or D, gently tug the catheter to make sure it's secure before cleaning. Remember, if you're tugging the catheter, you're tugging on his penis. That's going to hurt. So what do you do? Revealing the answer in 5, 4, 3, 2, and I think now I see some correct answers. All right, so the reason why it wasn't A is because you never want to clean towards the meatus. If you clean towards the meatus, let me make my screen larger. So let's say that this is the penis and this is the catheter. If you clean towards the meatus, you are pushing bacteria and germs inside of his urinary tract. So you never clean towards. You pinch the catheter and you clean going away. So the correct answer is going to be B. Rationale: when providing catheter care, it's essential to hold a catheter near the meatus to prevent pulling and clean away from the body, starting at the urinary opening and then moving down the tubing. This prevents bacteria from being introduced into the urinary tract. Again, never tug or reposition the catheter without a nurse's instruction. And I'm not going to tell you to tug on someone's catheter. That would be painful. Question 35. A CNA walks to a room and notices that the patient is tearful. What do you do? A, remain quiet. B, ask the patient, why are you crying? C, ask the nurse for help. D, offer tissues. And of course, I know you know this one because you all are great communicators and you are great caregivers. So you're going to show empathy and you're going to ask the patient why they are crying. All right, question 36. A patient recovering from abdominal surgery reports the urge to urinate, but is weak and has not yet been out of bed since the procedure. The patient is on fall precautions and has a urinary output goal listed in the care plan. What is the most appropriate action for the CNA to take? Would it be A, bring a urinal or bedpan and assist the patient while maintaining privacy and safety? B, encourage the patient to get up and walk to the bathroom independently to promote mobility. C, tell the patient to try holding it and check back later when the nurse is available. Or D, immediately notify the nurse and wait for further instruction without attempting care. And remember the scenario, everybody. They're recovering from abdominal surgery. They're on fall precautions. They need to urinate. What are you going to do? And that is right. You're going to have your equipment and your supplies available. If they can't get out of the bed, you're going to have the tools that they need to urinate in the bed. And because they are a fall risk, maybe you would have a bedside commode next to the bed so they would not have to walk to the bathroom. So since this patient's post-op weak and on fall precautions, getting out of bed without a proper assessment or support may be unsafe. So CNAs are trained to provide toilet assistance using appropriate devices like bedpans or urinals, especially when mobility is limited. The CNA should also monitor output and report abnormalities. Encouraging independent ambulation or delaying care could lead to falls or other complications. 37. Which observation should a CNA report immediately during catheter care? A, light yellow urine. B, a drainage bag with a secure cap. C, the tubing loops once before entering the bag. D, urine with a foul smell and cloudy appearance. What do you think your nurse is going to be concerned most about? Is it going to be a loop that you can fix or some strong urine? That's right. It is going to be D, you all, because that would be signs of an infection, and you should report that right away. Question 38. When ambulating a patient, they begin to fall. What's the best way to assist them safely? A, hold them up and try to stop the fall completely. B, step aside and allow them to fall to avoid injury to you. C, ease them to the floor while protecting their head. Or D, call for help and freeze in place. All right, our answer is coming in 5, 4, 3, 2, and hold up. I gotta come on camera for this one. Great job. I'm so proud of you. You all eased them to the floor and protected their head. Great job. And then you scream for help. All right. So assisting a controlled fall minimizes injury to both the patient and also you as the caregiver. Question 39. A PCT observes a new skin tear on a patient's forearm during repositioning. What should a CNA or PCT do? Cover it with a bandage and continue care. B, document the incident and alert the nurse. C, apply lotion and move on. D, tell the patient not to scratch next time. All right, it's just a new skin tear. Why do you even care? Because the skin is the body's largest organ. And if there is a break in the skin, it increases your patient's chance of infection. So you're going to document the incident and alert the nurse because skin tears need special care. Okay, we try to preserve that flap of skin. Hopefully it will reattach, but your nurse knows what to do. So get your nurse in that room. Question 40. A resident politely refuses to have their morning vital signs taken. Politely. Which response by the CNA demonstrates the best approach? A, can you help me understand why you don't want them taken this morning? B, I'll let the nurse know so she can force you to comply. C, that's fine. I'll just skip your vital signs for today. Or D, you don't have a choice. This is part of your care. Oh, y'all about to lose y'all jobs. Remember, patients have a right to refuse, and you have to respect their decision. So it is going to be A. Sometimes you all, it is something simple. They just don't want their vital signs taken right now because they want to watch TV and they're tired of you bothering them. You can come back later, but definitely give them the respect that they deserve and then communicate with them. You can try to tell them the importance of getting the vital signs, such as your nurse needs the vital signs so that before she gives you your morning medications. Now, if you don't obtain those vital signs, you need to go let the nurse know, and then you document that patient refused vital signs. You made your nurse aware, because if that nurse goes in and gives those blood pressure pills, those cardiac medications, and she's not aware that you didn't take the blood pressure, well, we can make the blood pressure drop. So it's important to communicate when and if a patient refuses. Question 41. What is the best way to identify a patient before providing care? Okay, so patient safety. Are you going to ask the patient the room number, ask for their name and social security number, call them by the name on the chart, or ask for their name and date of birth and check the wristband? And of course, for this one, more is correct. So it is going to be D. We're going to verify our patient by having two different patient identifiers. So for this case, you have their name, you have their date of birth. We're not asking patients for their social security numbers. And you're going to verify the information the patient is telling you while you are looking at their wristband. So confirming identity with two identifiers ensures patient safety and prevents errors. Question 42. While checking vital signs, the CNA records a pulse of 124, respirations of 18, a blood pressure of 122/80, and a temperature of 98.4. So 124, 18, 122/80, and 98.4. What is the condition called? Okay, so one of those was abnormal. Does this patient have tachycardia, bradycardia, hypotension, or hypertension? Let's go back. 124 is the pulse, respiration is 18, blood pressure 122/80, temperature is 98.4. Would that be tachycardia, bradycardia, hypotension, or hypertension? All right, revealing the answer in 3, 2, and I see a lot of people chose D, hypertension, but a blood pressure of 122/80 is still considered normal, even though 80 is on the higher end for a diastolic blood pressure. This is still a normal blood pressure. But for those of you all who chose A, you understand that a heart rate of 122 is faster than normal, and therefore that patient is tachycardic. So tachycardia is when a heart rate or a pulse is greater than 100 beats per minute. That can be caused by fever, dehydration, pain, or anxiety, and it should be reported. Question 43. Which of the following tasks is within the CNA's role when caring for a patient with a tracheostomy? Oh, you all know this. Can you suction? Can you change the trach ties? Can you replace the trach tube? Or should you monitor for changes in breathing and or secretions? Revealing the answer in 5, 4, 3, 2, and when a patient has a tracheostomy, what our CNAs do is they monitor. Hey, Bridget, I'm so proud of you. Thank you for coming to tell us that you passed your exam. We are so proud of you and good luck. What a way to start CNA week with all of you all passing your examinations. Question 44. A PCT needs to collect a clean catch urine sample. What is the correct step to ensure the sample is valid? A, collect urine after the patient has started urinating. B, collect the first stream of urine. C, collect urine directly from the catheter. Or D, pour the urine from the bedpan. Clean catch. You're catching something. So you're not pouring it, you're catching it. So for a clean catch urine sample, would it be A, B, C, or D? Remember, you're not pouring it if it's a clean catch, so it wouldn't be D. Revealing the answer in 3, 2, and you instruct the patient to start their urine stream, and then they will put the cup beneath them to collect the urine after they have started urinating. That prevents the bacteria that's on their skin from being collected in the specimen cup. So midstream urine reduces contamination from bacteria near the urethra. All right, so a CNA is assisting with feeding a patient that is on a mechanical soft diet. What food would you expect to see on their tray? A, tea broth and crackers. B, mashed potatoes and gravy. C, oh my God, I'm hungry, I haven't eaten, fried chicken and french fries. Or D, spaghetti and fried fish. As soon as this live stream is over, I'm going to have dinner. So, all right, so you're feeding somebody. Which of the food items would represent something that would be on a mechanical soft diet? And that's right, you all. It would be some mashed potatoes and gravy. So mechanical soft diet includes foods that are easy to chew, easy to swallow, and soft in texture. Question 46. A resident with dementia keeps trying to get out of the bed during the night. What is the most appropriate intervention? A, raise all side rails. B, restrain the resident loosely. C, use a bed alarm and provide a common bedtime routine. Or D, give the resident sleeping pills. Yeah, Mr. Lucas keeps trying to get out of that bed, and you're tired of him trying to get out the bed. So what are you going to do? Are you going to raise all the side rails so he can just climb over the side rails and fall? That's what's going to happen if you choose A. So that's right. For all of my people who are choosing C, you have it. So it's actually against most laws. If the doctor has an order for all 4 side rails to be up, you are restraining that patient. So usually 2 rails are up, but you are going to also activate the bed alarm system. So that would be a non-restraint strategy in order to reduce falls. So when you hear the bed alarm go off, you get into that room quickly. And then don't forget, if you notify the nurse, he or she can more than likely request that patient receives a sitter. Question 47. Which of the following oxygen saturation levels require immediate reporting? Would it be an oxygen of 98%, 94%, 91%, or 89%? Immediate reporting. Revealing the answer in 3, 2, and if you chose D. So the reason that it's not C is because our COPD patients and patients with emphysema, of course, you have to know a little bit about your patient. If they have those chronic lung conditions, they can have lower oxygen levels and they're okay with it. But so usually an oxygen level of less than 94% in somebody with healthy lungs would be concerning. But we're talking about you in the hospital. These patients may not all have healthy lungs. So when would you be reporting that, nurse? You can report it when it's 91%. There's nothing wrong with doing that. But for this particular test question, 89% was the correct response. So an SpO2 below 90 is considered hypoxia and is a medical emergency. The nurse should be notified immediately for possible oxygen administration. Question 48. A CNA is assigned to take vital signs on a patient who just drank hot tea. What is the correct next step? A, take the oral temperature right away. B, wait 15 to 20 minutes before taking oral temperature. C, take a rectal temperature instead. Or D, wait 5 to 10 minutes before taking an oral temperature. Hi, I'm doing a live stream. I'll have to call you back. All right, everybody, for question 48, the answer is B. That is right. So hot or cold fluids can affect temperature readings, so waiting ensures accuracy. Question 49. A resident asks if you would read the Bible to them, but you are an atheist. What is the most supportive action? A, contact the chaplain. B, call the patient's family and ask if they will read with the patient. C, acknowledge the patient's request and read to the patient. D, tell the patient that you do not believe in God and refuse this task. If you do D, you are cold-blooded. All right, so revealing the response, so the correct answer in 5, 4, 3, 2, and 1. So it's going to be C. You're going to acknowledge the request and read to the patient. It's not about you, it's about that patient. So acknowledging their feelings shows compassion and builds trust with the resident. Also, though religious views may not be the same, it's important to support and assist the patient. Question 50. A CNA is assisting a patient who is on strict I&O, that's intake and output. Which of the following should be recorded as output? Is it 200 mLs of emesis, 240 mLs of juice, 1 cup of water, or IV fluids administered? Revealing the answer in 5, 4, 3, 2, and yeah, I tried to warn you all about this system. It has not been acting right. So let me get back to the question we were on. But output is what goes out of the body. So that is right. Yes, Jennifer, I'm back though. Let me know. Put a 1 in the chat if you can hear me. I wasn't gone for long this time. So the correct response would have been A. And let me find where we were. All right. Does anyone remember what question number we were on? I think we were on maybe like 47. Okay, there we go. So that was 50. Oh, we were on 50. So, yeah. So it would be A, 200 mLs of emesis. Emesis is the medical term for vomit. So you won't really see us document in a chart that the patient had 200 mLs of vomitus. Instead, it's going to say 200 mLs of emesis. So output includes fluid loss such as vomit, urine, or diarrhea. And so food and intake items are not output. So what goes out is what would be measured. Question 51. Which of the following requires immediate reporting to the nurse during feeding assistance? Would it be A, patients eat slowly, B, patients refuses dessert, C, patient asks for extra water, or D, patient begins coughing and choking? Yep, you all got it. It would be D, because coughing and choking may indicate aspiration. Medical emergency. Question 52. Which statement by a CNA demonstrates an understanding of HIPAA? Would it be I shared her diagnosis with a roommate to help comfort her? B, I keep my patient notes in my locker at home? C, I only discuss patient information in private with authorized staff? Or D, it's okay to post about my shift online as long as I don't name patients. And you new nurses and new CNAs are losing your licenses so fast because you're trying to get clicks on social media. Look, you have to protect the patient's name, diagnosis, likeness. You don't know who knows who. And so protect your license, protect your income, and abide by the Confidentiality Act. So 52, the answer is C. That is going to help you protect your patients and protect your license. So HIPAA requires patient confidentiality and limits information sharing to authorized individuals only. Question 53. A resident with COPD, which is chronic obstructive pulmonary disease, becomes short of breath while walking to the dining room. What should the CNA do first? A, tell the resident to walk faster and finish quickly. B, instruct the resident to hold their breath to control symptoms. C, help the resident sit down and encourage pursed lip breathing. D, offer them water and continue walking. So a resident has COPD and they're short of breath. Remember, this is a chronic condition, comes from long-term smoking. So they have long-term chronic shortness of breath, dyspnea. And so if you are walking them and they become short of breath, we got to give them time. They got to sit down. It's going to be C, and they're going to use pursed lip breathing techniques because it helps to control their shortness of breath. And so it's a non-pharmacologic technique that helps keep airways open and improves oxygenation. Never rush or ignore respiratory distress. Question 54. While completing a bed bath, a resident complains that they are getting cold. What should the CNA do? A, ensure that the patient remains covered, only exposing the area that is being washed. B, stop the bath. C, document and notify the nurse. Or D, turn on a space heater. Your nurse doesn't need to know everything. Your nurse is super busy, so don't just bog him or her down with, unimportant information. So if a patient gets cold during the bath, what would you do as a CNA? And that would be to keep your patient covered and to keep them as warm as possible. Adjust the temperature in the room. You will not have space heaters or happy heaters in a facility. That would actually be a fire hazard. So the correct answer is A. Question 55. While recording a patient's intake, you realize you forgot to document lunch. What should you do after notifying the nurse? Like, oh God, I didn't document everything. Is it going to be A, estimate and write down what you think they ate? B, leave it blank. C, ask the patient if they remember. D, document late entry per facility policy. That's right, child of God. You have it. It is D. And so, you all, this concludes our practice test. I'm so proud of you. Remember that caring CNAs make caring nurses. Our website is fltraining.com. And if you haven't done so, please like our video, share it with others, and don't forget to subscribe to our channel. You all, it's been fun. I'm going to be on first thing in the morning, so I will see you all tomorrow. Bye, everybody.